infrequent bowel movements, pain, straining, bloating while on the toilet. These are all signs and symptoms of constipation. And in this video, we're going to discuss exactly what constipation is, some causes of constipation, when to see a doctor if you are constipated, and then finally, we're going to discuss lifestyle changes you can make and over-the-counter medicines you can take to relieve your constipation. Stay tuned. Greetings, this is Brandon E., your Pharm.D, and welcome to my YouTube channel. You know, all of us have experienced constipation at some point in our lives, but what exactly is constipation? Constipation can be defined as having less than 3 bowel movements per week, stools that are hard, dry, or lumpy, stools that are difficult or painful to pass, or having a feeling that not all of your stools have passed. So what are some causes of constipation? Number one, medications can cause constipation, particularly certain over-the-counter medicines like calcium supplements, iron supplements, antacids with aluminum, and then antidiarrheals. Other causes include diet, inactivity, stress, habitually ignoring the urge to go. And I have to admit, I'm guilty of this as well. Let's say you're at work or in a public place and you have to go number 2, but you don't feel comfortable using a public restroom or a restroom away from your house, so you wait and you continually hold it. Continually holding your bowel movement in can lead to constipation. So if you have the urge to go, try to find a comfortable place and go as soon as you can. Also, certain medical conditions can cause constipation, like irritable bowel syndrome. So if you are constipated, when should you not self-treat and when should you see a doctor? You should do so if you have constipation and then you have blood in the stool, symptoms lasting longer than 3 weeks despite you making lifestyle changes and taking over-the-counter laxatives. Or you have severe abdominal pain or an inability to pass gas or unexplained weight loss. So now that we talked about the causes and what exactly constipation is, how can we treat constipation? The first step we're going to talk about is to make lifestyle adjustments or make lifestyle changes. And lifestyle changes refer to things that we can do without taking medicine. The first one we're going to discuss is you want to consume an adequate amount of fiber. Fiber is an essential nutrient and it does a myriad of good things for the body. It can help lower our cholesterol. It can help us maintain a healthy weight. It can help to regulate our blood sugar. It can firm up our stool if we have loose, watery stool. But for this video, we're going to focus on the other aspects that it can increase our regularity in our bowels and it can help to treat and relieve constipation. This is important to know in that many Americans aren't getting enough fiber. The average adult gets about 15 grams of fiber per day, and most women need about 25 grams of fiber per day, and most men need about 38 grams of fiber per day. If you want to know how much fiber you need, you want to consume about 14 grams of fiber for every 1,000 calories you consume. So again, most of us are getting 15 grams a day, so we're getting half or less than half of what we need. So what type of foods have fiber in them? Fiber can be found in plant-based foods like fruits, apples with the peel, pears with the peel, oranges, bananas, berries like strawberries, blueberries, raspberries. Other foods have fiber like nuts and seeds, as well as vegetables and beans. And of the foods I just named, you want to increase your consumption of these foods to increase your fiber intake. But when increasing your fiber intake, you want to do it gradually over a week or 2. You don't want to increase it by too much all at once, as this could lead to gas and bloating. The second lifestyle change we're going to talk about relates to water. You want to drink an adequate amount of water. Water is a natural stool softener. If our bodies are dehydrated or don't have enough water, when we eat food, the food travels from our stomach to our small intestine to our large intestine, and in our large intestine, it'll pull water from our stool. This will cause you to have stools that are hard and dry and difficult to pass. So if you drink enough water, you'll have softer stools. And we'll discuss this a little bit later, but the stool softener DocuSafe, the over-the-counter stool softener, all it does is facilitate the mixture of stool fat with water. So why not just drink water instead? So again, drink a lot of water, and water will help to soften your stools. So how much water should you drink? There are a lot of different schools of thought, and there's the old traditional mentality to drink 8 cups of water a day. And then there's another school of thought to drink half of your body weight in ounces. The 8 cups a day is a good recommendation, and then most people probably aren't drinking that amount. So if you want to choose that method, that's fine. I would prefer to drink half of your body weight in ounces of water. So if you weigh 200 pounds, you want to drink 100 ounces of water a day. If you weigh 150 pounds, you want to drink 75 ounces of water a day. And then in addition to that, there are other things that you take into consideration, like activity and job and lifestyle. And if you're live a very active lifestyle, you may need more water even than that. So number 2, drink an adequate amount of water. Lifestyle change number 3 relates to exercise. And if you perform regular aerobic exercise, it may help move food through the intestinal tract more efficiently. And again, just like fiber, most Americans aren't exercising enough. The general recommendation for exercise is to get 150 minutes of moderate intensity exercise on a weekly basis. And so this is something like brisk walking. And you don't have to do it all at once. You can break it up and do 30 minutes 5 days a week. Or another option, you can do 75 minutes of high intensity exercise or vigorous exercise like jogging or running. And according to the CDC, about 46.9% of Americans are meeting the weekly exercise goal. So exercise. So these are the 3 lifestyle modifications: getting enough fiber, drinking enough water, and exercising regularly. If you do these 3 things, you probably will never need to take a laxative. And this is assuming you don't have any underlying medical conditions causing constipation. But I know there may be some circumstances where someone may be on a water restricted diet, so they can't drink enough water, or maybe somebody may be immobile due to having surgery, so they have to, lay around for a couple of weeks. They can't be as active as they normally would be. So if you can't do the lifestyle changes, or you do them and not working to the degree you want, from there you could take a laxative. There's 4 types of laxatives over the counter that we're going to talk about: osmotic laxatives, bulk laxatives, stimulant laxatives, and then stool softeners. Osmotic laxatives are the first type we're going to discuss, and these type of laxatives work very well. And when you take these laxatives, they increase the particle concentration in your intestines. So as a result, this causes water to flow into the intestines, softening stool, and as we know, softer stools are easier to pass. Some osmotic laxatives also incorporate with the stool, making it bulkier and larger. And bulky stools are easier to pass in that they stretch the muscles in the intestines, or stimulate the muscles or stimulate the walls of the intestines to contract so that they move the stool along. Osmotic laxatives vary in how quickly they work. There's some like the Fleet's enema with sodium phosphate that works in 1 to 5 minutes. And then there's the magnesium hydroxide formulation like the Dulcolax chews or the milk of magnesia that works in 30 minutes to 6 hours. And then there's Miralax or polyethylene glycol 3350 that works in 1 to 3 days. And there are many others. These are just some of the more common ones. And just because one works quicker or takes longer than another to work doesn't mean it's better. Miralax, again, takes 1 to 3 days to work, so it takes the longest to work, but it's actually the one I would recommend for most people due to it doesn't have a lot of side effects and has a lot of good data behind it. So with these laxatives, again, they work very well and they're fairly inexpensive over the counter, so they're good choices, but they should be avoided in certain populations. The saline type of osmotic laxatives, the one with minerals in them like magnesium and the sodium phosphate, you want to avoid these if you're on diuretics, if you're elderly, or you have a history of heart failure or kidney failure, as they can cause electrolyte imbalances. The second type of laxative we're going to talk about are the bulk laxatives. And bulk laxatives are fiber laxatives. And as we discussed earlier, fiber is very important. And the bulk laxatives retain water, and again, they bulk up the stool, and a softer, bulkier stool is easier to pass. There are a lot of different types of fiber laxatives. There's natural ones like Metamucil, which is made of psyllium husk, and then there's others like Fibercon or calcium polycarbophil, which is a synthetic version. And then there's other types like Benefiber and Citracel. Bulk laxatives are a good choice, and they take about 12 to 72 hours to start working. But some of them can cause gas and bloating. Just as I mentioned earlier, when you increase your fiber by a lot all at once, you can get some of these symptoms. And these laxatives should be avoided, the bulk laxatives, if you're immobile, you have a fluid restricted diet, or you have difficulty swallowing. The third type of over-the-counter laxative we're going to talk about are stimulant laxatives. And as the name suggests, these medicines stimulate the intestines to contract. And as a result, with the intestines contracting, they push stools through the digestive tract or the intestinal tract. Some of the more common names you may see, the generic names might be bisacodyl, senna, or senicides. These are very good agents, and again, they're very inexpensive. They work well. They can cause some cramping though, and they generally take about 6 to 12 hours to work to oral con. And the rectal con, that fleece enema with bisacodyl, can work in about 5 to 20 minutes. And there was some controversy at one point over these laxatives. Can they cause dependence? There was the belief that taking them chronically could make you dependent on them, and that if you stop them, your body wouldn't function normally to have a bowel movement. But in the short term, these medicines are really, all the medicines on the list are perfectly safe to take short term. But if you're needing to take a laxative, a stimulant laxative, or any type of laxative long term, you want to definitely consult with your doctor or pharmacist before doing so. The final type of laxative we're going to talk about are stool softeners. And stool softeners go by a lot of different brand names over the counter. You may see Colace as a stool softener. You may see the Philips stool softener. But no matter what type of stool softener you get over the counter, it's going to have the same ingredient, docusate, in them. And as I mentioned earlier, the stool softeners facilitate the mixture of water with stool fat. And stool softeners are good for hard, dry stools that are difficult to pass. And I have to admit, there's not a lot of good data behind the stool softeners and them being very, very effective. And when used, they're generally used in combination with other products like stimulant laxatives. And the stool softeners, they take about 12 to 72 hours to start working. And when you take them, if you drink water, it will help them work better. So now we discussed lifestyle changes you can make, as well as over-the-counter laxatives you can take for constipation. So I know I've given you guys a lot of information. So let's summarize everything. So let's say you're constipated and you've heard about all these lifestyle changes and all these laxatives you can take. What should you do? Where should you start? First, I will start with the lifestyle changes. I would drink more water, increase your fiber, and get more exercise. Do this for a 2-week period. If after 2 weeks you do these consistently, or let's say you're not able to do them for some of the reasons I mentioned earlier, like maybe you have surgery or you're on a water restricted diet, if you've done these for 2 weeks and not getting the relief you want, then move to laxatives. The laxative I would start with first is I would start with Miralax. Miralax is a good general laxative, and again, it'll take 1 to 3 days to start working. So let's say on the 3rd week after lifestyle changes, 3rd week you start Miralax, you take it for 3 days and it's not working. From there, I would go to a bulk laxative like Fibercon or Metamucil. And again, those take 12 to 72 hours to work. So let's say another 3 days goes by, you're still not having bowel moves. What should you do then? Then I would go to a stimulant laxative like bisacodyl or senna, or you could do bisacodyl with docusate or senna with docusate, a combination. And these should work between 6 and 12 hours from taking them. So if you've done all this, you've taken laxatives for a week, you've done lifestyle modifications for 2 weeks, and you're still not getting relief, I would not continue to self-treat yourself. At that point, I would seek the advice of your primary care provider. Make an appointment with your doctor, tell him or her what's going on, and be seen. Because at this point, you probably have some type of underlying condition causing the constipation. So this is the video on constipation. If you have any additional questions or something you want me to elaborate on, let me know in the comments. And I'll be happy to do more videos about this topic, or part 2 of this topic if you would like. So just let me know again in the comments. This is Brandon E, your Pharm.D. Remember to drink water, and hope this video helps.